Yes, Mr. Joy, I have a question. Many people ask, I'm a victim. Sometimes I get patients and ask me questions, then I look
Okay.
like lost. So, what is an ultrasound and what does it help us with in pregnancy?
Okay. Ultrasound. Now, before I talk more about ultrasound, I just want to give some brief history and some brief background. Some years back, when patients used to come to the hospital or to the medical fraternity complaining of issues, things like appendicitis, some kind of chronic pains, doctors had to, or surgeons had to operate because they didn't have a modality that would see structures in real time. So they could just operate and look at structures after operating. But due to advancement in technology and growth, they invented ultrasound. And what is ultrasound? Ultrasound, basically, it is a modality where we use waves, very fast waves or high frequency waves that can help us see the structures in the body, for example, organs, soft tissue, or blood vessels in real time. In other words, I'm trying to tell you that we can see structures inside the way they are. If it is the heart, we can see it beating. If we have blood vessels, the blood is moving at a certain velocity, we can see it move at that very velocity. So we are seeing structures in real time. So it helps doctors judge to know that we can handle this case this way. This is an emergency, for example, if it is appendicitis, maybe if it is any kind of emergency, they know how to make proper judgment. So we are basically studying deeper structures without cutting the patient. We are using this, and we usually use what we call probes. Probes, these gadgets that will help us transmit this wave through the girl into the soft tissue of a patient to study those structures. Yes, that
Which
is
means
it.
without that girl, you see bright things?
Without girl is a medium that will allow our waves to travel or be transmitted to structures or to parts deep. Yes, without it, if that media is not there, you cannot see structures inside there. So as a mass, you have to apply that girl. There should be a medium that allows the waves to be transmitted through the soft tissue to the structures we want inside there. Yes.
Okay, so is ultrasound only for women? Because most people think it's only for pregnant women. It's only pregnant women that go for scan.
Okay.
Do also males, both males and females, go for scan?
As long as you have soft tissue, you have body. This any body part can be diseased, can be affected. If a man has an eye, a woman has an eye, these are all soft tissues. So if they get problems, we can see them using ultrasound. So ultrasound is not specific to any gender. Any person can be examined using ultrasound, whether babies, whether women, whether men, whether young, whether old, use ultrasound. So it's not for only pregnant women, but any structure on your body can be assessed using ultrasound. Yes.
So how safe is the ultrasound machine? Because everything which comes with technology.
Okay.
Sometimes I even fear, why would you put me that girl?
Oh, okay.
And even most patients come saying that they had scan has amasanyalaze radiation, and they get confused somehow.
Okay. Now, ultrasound, there is no recorded side effect of ultrasound. So ultrasound is, if we said we use wave, and this wave is non-radioactive, does not result in change of body cells from the natural state to another state. So ultrasound is just a use of a very high moving wave to see structures. So there is basically no recorded side effect of ultrasound. Yes, so it is far different from X-ray, CT, MRI, where we use radiation. Now, radiation, when you get exposed many times, that's when it may affect the body cells and bring it to other side effects. But for ultrasound, there is no recorded side effects. Probably, maybe if we to do Doppler, is where we can limit it in first trimester. Yes, because the baby's body parts are growing very fast. We don't want anything to affect. So it's only exceptional, probably in Doppler in in embryos that are very early, in embryos actually. But if you come, you have a baby or whatever, ultrasound is completely safe. Completely safe.
So does that mean a pregnant lady can come even every week to scan?
If there is need, probably I wouldn't say that you will always have a need every week to come for ultrasound. But what we usually one of the, how should I put it? The recommended times, at least for every woman who gets pregnant, at least 3. That in every trimester or every 3 months you do a scan, because there are things we see in the first 3 months that we need to tackle in detail. The second 3 months, the second trimester, tackle in detail, and in the third trimester. So you find that if a woman misses a certain form of scan in those 3 months, there are things that you may pass, and yet they are going to affect your baby. So it is very relevant to at least a minimum have 3, or on a bare minimum have 3. However, even if you have more, there is no recorded serious side effects of ultrasound. Yes.
Okay, that has been a question that has been actually many people ask that because they don't see, and also the right time to do those scans. Like I maybe have missed my periods, and what is the right time to begin doing that? I mean, to request for that
ultrasound. As long as you have a positive HCG. HCG, this is a pregnancy hormone that only comes in when a woman is pregnant. And there are a few exceptions where a woman can be recorded with a positive HCG but not pregnant. For example, there are tumors, like pituitary tumors, that can result into overproduction of HCG beyond the normal levels that can be detected in blood and urine. Those are few exceptions, but under normal circumstances, you are expected to be pregnant as long as you have a positive HCG. So, as long as you've detected that you have a positive HCG, you're due for scan. Why? We want, first of all, to ascertain, is this pregnancy in the right position? The pregnancies that grow outside the uterus, we call them ectopic pregnancies. Now, these under normal circumstances, a baby cannot grow outside the uterus. A baby grows within the uterus. Okay, so there are cases whereby you find that a fertilized egg fails to be transported from the fallopian tube where it's made to the uterus where implantation happens. And what happens then? A baby starts growing from that place. And since there are no conducive things, or the environment is not conducive for growth, you'll find that the baby will grow in that area, and that area will leak and burst. Now, in such cases, you'll find that it becomes an emergency. You have a leaking ectopic, and then it ruptures. Those are cases whereby you see a mother going into shock and they die. You see, that's why we say ectopic pregnancies are emergency cases, because if it grows from a place that it's not meant to grow, it's just a matter of time. That area will give way, blood will flow, you will have peritonitis, you will have a lot of hypovolemic shocks, and you will die.
And what do they do for such?
Now, for such cases, as I said, if you come and you have an ectopic, this is an emergency, so it is a surgical case. You will be rushed to the hospital. They will check you look at your HBs, if your volumes of blood are okay, and then they will decide to do an operation on you. So a baby cannot grow in such a place. A baby will only grow in the uterus. So these are surgical cases. You shouldn't be deceived that a baby is going to grow from such a place. Yes.
So also, I'm feeling like, under any circumstance, can they advise maybe to terminate that pregnancy?
Termination, the uterus can be accessed through the vagina and to it. Okay? But now, in an ectopic pregnancy, there is no route that will help us reach it. So we only terminate what is easily accessed. But now, I wouldn't don't want even to say termination. Okay, getting rid of any pregnancy. But these ectopic pregnancies are not in direct routes that you can easily access them. They are in tubes, they are in ovaries, they are in the peritoneum, the liver, and what. You can only access those areas surgically. That's why in most cases, it has to be a surgical intervention. You're operated upon, and then that area is repaired. Remove whatever is there, remove the hematomas and what, and then your life is saved as a woman.
Wow, I'm learning new stuff here. Are you?
Yeah.
Okay. All right, now there comes the question again. Why should the pregnant woman do ultrasound?
Why would a pregnant woman do ultrasound? One, first of all, we said pregnancies are meant to be in the uterus. Now, when you go and you check your urine and find out that you're pregnant, the question is, where is your pregnancy? So we will need to do an ultrasound scan to confirm that you're pregnant and the pregnancy is in the right position. That's the first thing. If you don't do it, you may get issues, as we just talked about ectopic pregnancy. There are other pregnancies that, for example, will not result into formation of a baby. For example, belated ovum, or what we call anembryonic pregnancies. These pregnancies, you find that a mother conceives, goes through all that a woman goes through. But when the pregnancy gets to 7, 8, 9 weeks, the mother starts bleeding, begins getting cramps and other things. And when they come to us, we find out that we are expected by that gestation age to have an embryo inside, but you find there is no embryo, and you find that the cervix is, the gestation sac is getting irregular. It is deforming. The gestation sac is where the baby sits. It loses shape and loses its normal outlook. So no embryo, irregular gestation sac. Then we shall confirm that this is a blighted ovum. That is 7, 8, 9 weeks plus. So such pregnancies we will not know if not done a scan. Ectopic pregnancies. There are other pregnancies like molar pregnancies. Molar pregnancies, you get a certain kind of, we call it trophoblasts, or they are tissues that form where the baby has to form. So it can be partial or complete. Partial is where you have a baby growing with a certain meat inside. I would call it a form of meat. It's such mass, but it is not properly. It's not meant to be there. So you cannot know these things if you've not done a scan. Total or complete molar pregnancies, there is no baby, but you see the uterus gets filled with we call it a mass that appears like, a honeycomb. This honey, the beehive where they remove. The way it appears, you have something like that in your uterus. Those things, you cannot know them. You can have a positive HCG, but you find that when they do a scan, there is no baby. You only have that. And when they go and do beta HCG, you find that the beta HCG is too high. So these things, you can only know them when you've done a scan. So you need to know that you have a real baby inside you, and the baby is in the right position. Now, there are cases, another thing is we need to know how old is this pregnancy. There are women that get pregnant when they don't know. There are women that are raped. There are women that are moving the wrong life. As a Christian, I wouldn't advise that. But they are there in the hospital, work on everyone. A woman comes and she doesn't know when she conceived.
Yeah, especially those who have been on
Exactly. Family planning. Someone has been on family planning, they don't know when they conceive. Now, ultrasound is capable of determining how old this pregnancy is, starting from the time the sac is there to the time the baby has grown. So it can you do an ultrasound, know how old your baby is or your pregnancy is, and for proper planning. These days, ultrasound scans help people plan, show up for their babies. They know the sex of their babies. You get. So it is very important to check yourself and know which gender you're having and how other things are going to be concerning you. Okay, so it is very important. 3, there is monitoring fetal growth. You may have a baby that is formed inside, but you need to know, is the baby growing proportionately at intervals? You may have a baby that starts growing well, but on the way, the baby starts retarding. You get what we call retarded growth. So you need to follow up this baby, that you ensure that the baby grows up normally till term. Term is 40 weeks. So these scans help you monitor the growth and development of the baby till the baby is given birth to. That's why it is important for you to come. You may be with a baby and the baby stops growing at a certain point. Have you heard of stillbirth? The baby is growing and the baby dies inside. You no longer feel any movement, the baby has died. So you come to scan, they tell you the baby is either alive, retarding, or growing normally. And now there are some pregnancies where babies have anomalies. There are things that are not forming, they didn't form well. Have you seen babies with big heads? Hydrocephalus. Have you seen babies with defects with the heart? Babies with gastrocchitis, you find the intestines are growing from out through the umbilical cord. The anterior abdominal wall has a defect and the intestines are growing from out. Babies without the skull and the brain, and encephaly. Babies with spina bifida, the bones of the back give way and the spine is growing outside. So these things, you will never know them if you don't do an ultrasound scan. So it can help you detect anomalies. So we have a scan set specifically for anomalies. We call it an anomaly survey scan. It's usually done between 18 weeks and 24 weeks. So that scan is very important because at that age you expect that all the body organs have grown. So if there is any anomaly, we can easily detect it. So it is very important. We need to know, is there an anomaly on your baby? Do you want to produce a baby with a big head, a baby without hands?
But in that case,
when you find out the baby has a big head,
yes.
When you find out the baby's abdomen is not covered, what do you do?
Usually, doctors know how to handle. They will give you judgment. They will just come and ask you, based on this, they will tell you the advantages and disadvantages of staying with a pregnancy. They will tell you this baby, when you produce this baby may not survive for the next 24 hours. Or they may tell you, this baby may survive, but you're going to struggle with this baby the rest of your life. So they will give you options. You either terminate the pregnancy, or you'll be ready to suffer the consequences. So this one helps you to prepare for whatever you're having. So if you don't do this, these are the people that you produce conjoined twins, baby with joined parts, 2 babies but they have the same head. They have the chests are joining. These things you can only know them if you've done a scan. And when you do a scan, they can prepare you before you give birth. Yes. Another thing, you've heard about multiple pregnancies. You need to know, am I carrying 1 baby or I'm carrying 3 babies? You see, it's very important for you for accountability. How are you going to?
There we are talking of twins,
yes, twins, triplets, quadruplets. Like for you to to know, am I carrying one baby or 2 or 3? Are you a Nalongo? Are you a Salongo?
Okay.
Yes,
show.
so
Look for money.
look
I
for
think
money.
I can feel it.
Exactly. Another thing, placenta. Now, placenta, there are cases whereby these placentas, okay, there are cases like placenta previa, cases like increta, accreta. These are medical terms. I don't want to talk about them like that. But there are cases whereby this placenta, you find it low-lying. It goes and covers the birth canal of a woman. And when this placenta covers the birth canal of a woman, if you don't do scan and doctors get to know about it, you may reach time to push and you push against the placenta that has covered the birth canal. Now, when you push, this placenta is made in such a way that it has a lot of blood. When you press it and it bursts, the baby will get a lot of blood in her, him or her, and then you will also lose a lot of blood. And we may lose the mother and the baby. So we want to look at the placenta location. Over 28 weeks, is the placenta still low-lying? Is it covering the internal os or not? So you cannot know these things if you've not done a scan. So if it is there, we look at a way of helping the mother. We just know that this mother will not push, this mother will be for a cesarean section. You get. And then another thing we talk about is the amniotic fluid. The baby in which the fluid in which the baby grows and does all that has to be in a certain range. If it goes beyond that range, it communicates something. If it is too low, it still communicates something. If it is not there, it also communicates something. But you cannot know these things if you've not done a scan. So it will help the doctors know, is this do we have what we call polyhydramnios, that we have too much fluid or water, or we have little water that will not facilitate normal growth of our baby, the oligohydramnios. And in hydramnios, there is completely no water. So babies cannot grow without water. And babies are at risk of having a preterm delivery. There are many risks of having a preterm delivery if there is little water. So these things we can only know them when you do a scan. Maybe another thing I can talk about, their complications.
Like
I will talk about a lot of complications, but I don't want.
So let me ask a question about that. Like a mother doesn't have much fluid. What would happen? There's no way of increasing, maybe.
Basically, under such cases, there are high chances that you're going to lose that pregnancy. When you completely lose your water, for example, you may have premature rupture of membranes and you pass out all the water. In most cases, you're most likely going to lose that pregnancy. Yes. So that's why it is important to monitor yourself till your baby is ready to be given birth to. Oh yes. Any other question? Because I have many reasons for time, but I don't want to take a lot of time.
There are so many in our heads.
Oh yeah.
We have to limit them.
We shall ask it next time, and we are very, very grateful. Dear viewers, I hope you've heard the advantages, disadvantages of doing the scan. What is the scan? And why do we need to do the scan as soon as you conceived? You have to know whether the child is in a good position, whether the child is inside or where the baby is supposed to be, inside the uterus or outside. So in case you have any query, you can type in the comment or you reach out to us. Subscribe to this YouTube channel of Joel Ruchamuzi. Thank you for watching. I wish you all the best. Thank you for coming.
Thank you.
Bye-bye.